Asymmetrical lips. Could Botox or surgery cure this? My lips are not symmetrical. When I talk or smile or whatever, one side seems to pull down, whilst the other doesn't. I've had this since birth, but seems to be getting worse. Is there any surgery that can cure this? The left bottom lip is thinner than the right one. Could Botox or some surgery cure this?
Thank you for your question. You've submitted photos and you describe in your question that you've had a crooked smile since you were born, and you're asking if there is a way that Botox or surgery can address this issue. Well, I can certainly give you my perspective. I'm a board-certified cosmetic surgeon, fellowship-trained oculofacial plastic surgeon, and what you are describing just with the photos is something that first needs a diagnosis. I've been in practice for over 20 years, and the appearance you have is actually something we watch for when we perform surgery such as facelifts. And so let's start with the diagnosis that's most likely just based on the photos alone. Of course, in the absence of a physical examination, there may be more issues that are also related to, that happened neurologically at the time of birth or prior. So to begin with, what you have is a failure on the left side for the lip to come down with smiling. Now, the reason is because of a particular muscle called the depressor anguli oris muscle. This muscle is innervated or receives its signal to contract from a nerve called the marginal mandibular nerve. Now, the relevance of this is that in situations where there is a trauma, such as an actual accident or a surgical trauma that happens during surgery, such as facelifting surgery, or even from injectables, that nerve can develop what's called a neuroapraxia, a temporary lack of activity which improves with time. And so initially a lip can be up, and then and that same muscle is actually the muscle that you use to show your lower teeth. And so as time goes on, the nerve restores its function and then is able to innervate that muscle, and the muscle contracts. But in a situation like yours, where it's been there since birth, there is no expectation that there's something can be done with the nerve itself. And the way people often will strategize either the temporary neuropraxia of surgery or even something like in your situation is to actually use a drug like Botox on the opposite side. And as strange as that may sound, where you are purposely weakening a muscle to try to match the weak or permanent paralysis or weakness of the muscle on the other side, is that symmetry very often is more desirable than this obvious asymmetry. So it might be worth considering. I certainly would not recommend any surgical procedure because I don't think you would get a result that will be of value. There are different types of surgeries that are used for people who have more profound facial nerve paralysis. But in your situation, remember, surgery can only do so much, but this is an area that moves. And so when you correct to a certain point, it's not likely that you're going to get a really great improvement in the overall symmetry. So what you can do is experiment with the use of Botox, where the opposite side, or the contralateral side, is injected with Botox in a way that relaxes the same muscle, and see how you like the improvement in symmetry. It is something that is fairly low risk because the Botox does wear off. And so within 4 to 6 months, it can wear off, or you can do a very, very low dose and just test it and see how you like it. So I think that the only option that would be worth considering is to do what I just recommended or recommend you consider, is to see what happens when you relax the other side and see what it looks like when you smile and that both corners go up and the lip comes up in the same way. You know, our brains are kind of wired to perceive both symmetry and asymmetry. So when it's more of a symmetric appearance, then I think that the attention will be less drawn to the lip area. So I think that that may be a good strategy for you to try. Botox does require continuous maintenance, so it may become a part of your lifestyle to do that. But otherwise, I wouldn't entertain any other possibilities in the surgical realm because I just don't think you'll get what you want, not at this point of time. So I hope that was helpful. I wish you the best of luck, and thank you for your question.